everyone here is doctor, right? So I am continuing neonatology, basic neonatology, right? So if you say like neonatology means it's a subspecialty of pediatrics. Already pediatrics is already one extra branch in that subspecialty neonatology. It deal mainly with from new birth to till 1 month of age. That is called newborn period and neonatology period, right? So there is timeline, like gestational age, from where we calculate gestational age from the first day of mother's last normal menstrual period. So this is the clinical method of calculating gestational age of the baby. Like if mother get pregnant, okay, so last, if you will take last this last LMP period, like last menstrual period, if you will calculate 40 weeks or 280 days, then you will calculate gestational age. This is one clinical method. And next method is what you can go through by uh, ultrasonography, first trimester, second trimester, third trimester, USG. Best for the gestational age, first trimester, for the calculating the gestational age. Why gestational age is important in neonatology? Because so many things of neonatal care depend upon the gestational age. On this, we'll decide term infant, preterm infant, late preterm, post-term infant, right? So this, if you don't know the gestational age, the management of the baby will be get newborn will be hampered. So first of all, we should know the gestational age of the baby. So in that, you by clinical method, by investigational method. So it come to by ultrasonography. The first trimester is best for the LMP. If you do ultrasonography on the first trimester, will come there will be accuracy within 5 to 7 days of the actual gestational age. Means लास्ट मेंस्ट्रुअल पीरियड में और आपका यूएसजी का रिपोर्ट 5 से 7 दिन वैरी करेगा, ठीक है। और बाकी अगर सेकेंड ट्राइमेस्टर में आप कराते हो डेटिंग स्कैन के लिए, तो इसका डबल कर देना है, 5 से 10 और 7 से 10 to 14 डेज वेरी करेगा। ऐसे याद करना है आपको, ठीक है, कि अगर फर्स्ट ट्राइमेस्टर में किसी ने मिस कर दिया है यूएसजी, अगर सेकेंड ट्राइमेस्टर में आ गया है, तो आपको अल्ट्रासोनोग्राफी कराएंगे तो उसका जो एक्सपेक्टेड डेट ऑफ डिलीवरी होगा 10 to 14 डेज वेरी करेगा, ठीक है। सो एवरीवन शुड नो कि टर्म इन्फेंट क्या होता है, प्रीटर्म इन्फेंट क्या होता है, लेट प्रीटर्म क्या होता है, पोस्ट टर्म क्या होता है, ठीक है। तो टर्म इन्फेंट का बोलेंगे, नाउ यू 37 to 42 वीक्स, दैट इज कॉल्ड टर्म इन्फेंट, and preterm infant is before 37 week, and late preterm is, you can see in this PPT same near term is 34 to 37 week, and post term is after 42 weeks. So no, neonatal period are divided into two part, early neonatal period or late neonatal period. So early neonatal period, from birth, so you should know when we call early neonatal, or this is called postnatal period, from birth to 7th day, and late neonatal period 7 to 28 days after birth. So I think everyone now familiar with this word, right? So what is gestational age, how to know the gestational age? Now this terminology is very important in the terms of an ICU setup. If you are very confused about this, then your management will surely hamper on clinical basis, because they thermoregulation management, fluid management, all this depend upon the gestational age of the baby. So many things, I'm telling only 1 to 3 point, be very important. Okay, so I'll go for the next slide. So now again, same here, you can see the gestational age. I shown this same whatever I told you now before this slide, which I did in this graphical representation is there. Okay, so first gestational age, then from gestational perinatal period to birth, then postnatal period and late neonatal period, then prenatal period is very important.
Welcome to the world of neonatology. It's the branch of medicine devoted to newborn care, especially for premature or critically ill infants. Neonatologists monitor every heartbeat and breath. They ensure proper breathing, nutrition, and warmth. The NICU, a place where every second counts. Here, technology and compassion work together. Each breath brings new hope and healing, from fragile beginnings to strong, healthy lives.